So we just recently posted an update on Lenora. Lenora is one of our patients who flew in from the East Coast. She's about 6 weeks post-op in this updated picture she just sent us. And look at her beautiful jawline. It looks very youthful, natural, refreshed without being harsh, and it fits with her face, which we are just totally loving, and she's so happy. Now, how do we get here? So you can see in this image here that despite Lenora being really fit, she takes amazing care of her skin, she has a lot more laxity than you would anticipate just by looking at her at rest. You can see here in this side profile a little bit of laxity, but this is also where we're starting to see some fullness in this area here. That even if we were to tighten the platysma muscle, tighten the skin that we do in an extended deep plane facelift, we would still have remaining bulging and fullness here despite getting rid of the extra skin laxity. And you see she's got nice bone structure. She has a good jawline, but we have some structures that are causing some fullness there that are gonna impede the ability to really see that nice structured jawline that you saw in the picture she just sent us. So I'm going to tell you a few steps that we did to get to this beautiful jawline. Now, if you are adverse to surgical images, you don't like anything graphic, now would be a good time to get off the post. We are going to be posting a few intraoperative images of what I did. So with her, we did a structural neck lift where I trimmed the portions of the submandibular glands that were sitting kind of underneath her jawline, causing issues in that area. So you can see here, this is when we're in the operating room, the patient is intubated, she is asleep. You can see the fullness that we have here on the left side versus the fullness there on the right side. She's asymmetric as well. So being able to get a more defined jawline on the left would be challenging without addressing the structures that are leading to her asymmetry. So I take a submental approach. So I go right underneath here, which is called the submental area. I make a small incision and I'm able to access underneath the platysma muscle the structures that are causing this asymmetric bulging. Again, we're going to be showing some graphic surgical images, so if that's not for you, you can go ahead and close out the screen. So we make an incision here. After we make the incision, I'm able to access the fat that's underneath there. Lenora is really thin. We don't have any fat there. I then elevate her platysma muscle, which you can see those lines that I drew down the center of her neck. Those are her platysma bands. So that is something that I address in the operating room as well. I elevate the platysma, and then underneath the platysma lies your digastric muscle here anteriorly and your glands laterally. So what I do is I trim the bulginess of any muscle there, and then I trim any of the gland. I kind of reduce the volume that's sitting below the angle of the mandible. Here's one of the intraoperative images. So you can see now that the gland has been removed, you can see the volume of the gland that's there, and you can also see the dip where that gland is no longer adding volume. That's going to help with her jawline definition. This is after both of the glands have been trimmed. I took more from the left side than the right because that was the side that was bulging more, and we never want to take more gland than's necessary, but you can see how she has a nice little dip there now where it's been debulked. So this is what we took out. The top part is the small portion of her digastric muscle that we trimmed, and then we have, this is in anatomical position. So the left is going to be on the right side of your screen, the left portion of her gland and the right portion of her gland that were hanging too low. And that's what helped us get. And that's what helped us get to Lenora's happy, beautiful side profile where she's been debulked in a very natural, aesthetic, pleasing manner. Let me know what questions you have, DM or comment below.